Well, my name is Dr. Rod Story. I'd like to talk to you a little bit about coronavirus. I'm away at a conference, and it's in a beautiful place, as you can see. One of the great things about conferences is the chance to hear from experts in their field. We have an infectious disease doctor who's been speaking to us about coronavirus. You're probably waking up and reading about it on the news and wondering what its impact is going to be for your family. A couple of things I'd like to tell you, just to give you some context. First off, coronavirus is not new to humans. You've probably had coronavirus already this year. It's basically a family of common cold illnesses. This is a unique one. It's not been seen in humans before, and because of that, when people do get it, they seem to get an aggressive immune response, and that's what makes people sick. So really, the people that are getting sickest, at least from the China experience, are those that are elderly, over age 70, those that are maybe compromised in their health, prematurity, or significant health illness that's underlying. And those are the people that are getting the worst cases. The reality is that almost everybody that gets it, meaning the vast majority, and millions already have gotten very, very mild. And some are very asymptomatic. In fact, it seems that children are likely the ones that are getting the most mild cases, and it's the older adults that are getting the worst. So, what does that mean? Well, first off, you should be aware that coronavirus is not yet in the United States. The cases that you might be reading about are all people who are in isolation, who were brought over from the cruise ship or other places, and it's not circulating currently. But it will. Pandemics go that way. This is a very similar, we think, pandemic to the swine flu that occurred in 2009, where it was widespread. A lot of people got it. A lot of people feared it and came to the emergency rooms and overwhelmed our local emergency rooms. But actually, most people's cases were very, very mild, and it was those that had asthma or were very old that had the worst time of it, and some even died from it. So, vigilance is what I would encourage. First off, keep your ears open. When you do hear that it is circulating in the United States, close up your contacts, maybe avoid some social circles for a couple weeks if you are at high risk, meaning, again, over 70 or significant underlying health issue. Pay attention to the news and the recommendations. But I'd say also on the opposite side, don't spread fear. Don't hobble up. Don't disappear from society. But let's keep an eye on this together. Thank you very much.